Hi, this is Tom Moll with SIU Family Medicine in Decatur. I'm a licensed clinical social worker. Today I'd like to talk to you about coping with stress, anxiety, and depression during this time of COVID-19. People who have already suffered with anxiety and depression are experiencing an increase in symptoms during this difficult time. Conversely, people who have never suffered from stress, anxiety, and depression are also increasing symptoms for the first times in their lives. This can be quite scary. The big part of COVID-19 is not only the health impact, but also the psychological and the pain that people are feeling from being so isolated, depressed, perhaps experiencing loss of work or loss of means to take care of themselves for the first time. The following is just a few simple tips to try to help you cope. Remaining on a schedule helps a lot when you're at home. During the time when we're not at work or not going out amongst our friends, it's important to try to sleep and wake at about the same time every day. This is a little bit difficult. It may take some practice, but with some good timing and also taking care of ourselves appropriately throughout the day, this is still possible. It's important to eat regularly and sometimes healthily during this time as well. Remain on your medication schedules prescribed by your doctor for all medical and behavioral health needs as well. Remember, it's okay to still socialize. It's okay to use technology to reach out to friends, neighbors, and loved ones. It's okay to make calls on the phone. It's okay to reach out to people you haven't talked to in quite some time. Chances are they're experiencing the same things that you are as well. It's okay to share emotion and feelings with each other. It's also okay to reconnect and find some joy in old story sharing or perhaps having a funny moment between yourselves. It's also important to realize there are activities that we can do to change emotions that we want to change. For instance, if you're having a lot of strong emotions and not coping that well during the day, it's okay to put on music that does make you happier. It's okay to read a book that can pique your interest and take your mind off and compete with the strong emotions that you're experiencing at the time. Other people may want to watch a movie or a complete series on TV to make sure that they're coping well. It's also okay to do the yard work and do anything around the house that can help you cope better and strategize how to keep your days busy. Also, people can use this time to make sure you control the consumption of news, or what I call bad news, throughout the day. It's important to stay up to date for your health and well-being, but it's also okay to limit the amount of time that you're consuming this time's rough news schedule that we're experiencing on a daily basis. I also encourage people to use mindfulness skills. Mindfulness skills are wonderful. They help you connect to yourself in the moment. It's as simple as going outside, feeling what the sunshine feels on your face, noticing the changes in your yard, such as the green grass or how the trees are blooming, and also taking charge of how you can help maintain emotions in the moment. Other mindfulness skills would be looking up a brief meditation, or also taking time to name objects outside that you haven't typically been paying attention to. Some people are even taking walks where they're naming objects and looking around themselves to notice things in their town or their little area that they haven't been paying much attention to. It could be from hearing the dogs barking to noticing how the leaves are blowing in the wind. So using mindfulness skills are also beneficial. Lastly, I'd like to talk about controlling things that you can. A lot of anxiety happens when changes are occurring around us and we feel we have no control. There are some things we can still control. How we talk to each other, how we respond to each other, random acts of kindness that we can still do for each other without even thinking too much about it. Getting outside of yourself and what you're feeling in the moment is another excellent coping strategy. Please take care of yourself, take care of your loved ones, and take care of each other. Thank you.